Hi all, welcome back to my video. This is Priyadarshini and tutor in SNS College of Physiotherapy. Now in this video we are going to see about lung abscess, which is the respiratory disorder or disease. Definition: the lung abscess may be defined as the localized collection of pus within the lung parenchyma resulting in the necrosis and cavitation due to the infection. So it is nothing but the localized collection of pus in the lungs, simple words. Size: it is typically 2 cm in diameter and can be single or multiple pus formations. Classification: there are two types of classification. One is primary classification and another one is secondary classification. The primary classification of lung abscess: it is when abscess develops in the individuals prone through the aspiration. Aspiration is nothing but the food particles entering into the lungs which causes the deviations of the respiration, that is known as aspiration. Secondary lung abscess, it is due to the obstruction or intrathoracic surgery or due to the systemic condition like pulmonary embolism or failure of lungs. Next, epidemiology, global burden, common complication of pneumonia. The lung abscess is one of the most common complication of pneumonia in high-low resource set areas, and in India, it is associated with poor oral hygiene, alcoholism, smoking, and immune suppressions. Age, that is both young and elderly are affected. Mostly youngs are affected by the primary lung abscess and elderly are affected by the secondary lung abscess. Mortality rate is up to 5 to 10% with treatment and high in immunocompromised disease or disorders. Etiology or causes of lung abscess: the primary causes is mainly due to the aspiration of oropharyngeal contents. Secondary causes is mainly due to the pneumonia because lung abscess is the secondary complication of pneumonia, bronchial obstruction, hematogenous spread. Common organisms which cause the lung abscess are anaerobes, aerobes, and fungal actinomyces, etc. Risk factors of lung abscess are smoking, alcoholism, poor oral hygiene, as I said earlier, dental diseases, immune suppression, aspiration risk, underlying diseases like COPD and bronchiectasis. Pathophysiology: aspiration of infected material or foreign body or the food particles enters into the lungs and it may cause the pneumonitis, impairs drainage of fluid or aspirated material, which may leads to the inflammatory of vascular destruction or obstruction, and it causes the tissue necrosis and liquefaction that leads to the abscess formation or lung abscess. Clinical features or symptoms of lung abscess are acute, chronic. Stages are in acute stage: fever, chills, productive cough, and hemoptysis are the main clinical features in the acute stage of lung abscess. Chronic, it will cause the weight loss, night sweats, and fatigue. Physical signs of lung abscess are clubbing, that is the rapid onset of breathing disorder, and dullness to precaution, reduced breath sounds are the physical signs of lung abscess. Diagnosis: it can be examined or taken by the history like smoking with persistent cough or hemoptysis. Investigation include chest x-ray, cavity which shows the cavity with air fluid level, and CT confirms the size and location of the lung abscess. And complications to sputum culture for organisms like anaerobes or antibodies, and blood CBC, anemia, and ESR elevated rate can be the investigation for the lung abscess. Bronchoscopy if obstruction is suspected. So differential diagnosis are lung cancer, tuberculosis, bronchiectasis, fungal infection, and pulmonary infect. Medical management include clindamycin and penicillin plus flagyl, metronidazole 400 mg if the foul smell is present in the sputum, and oral administration of antibiotic therapy should be continued for 4 to 8 weeks. Surgical management includes the indications, that is, if the abscess is more than 6 cm or failure of medical therapy in that cases surgical management is advisable, and the complications are empyema and hemoptysis. Procedures may include percutaneous drainage, bronchoscopic drainage, and lobectomy. Lobectomy is nothing but the surgical removal or repair of lobe. Complications may include empyema, bronchial fistula, septicemia, residual fibrosis, and massive hemoptysis in emergency cases. Prevention, it can be prevented through smoking cessation, good oral hygiene, aspiration precaution in elders or neurological patients, and vaccinations of pneumococcal influenza for risk groups like children. Prognosis with treatment 80 to 90% of resolution. Those who are under the treatment may get developed. Those who are under the treatment got low mortality rate. Poor if delayed diagnosis or complicated. So if the diagnosis is very late, or if the patient doesn't know, doesn't aware of the lung abscess, it may cause the mortality rate.